What is trance? And the distinction between that and hypnosis. So for all of us, I think it's important. And one of the things that I deal with on a fairly regular basis as the editor-in-chief of this journal is the conflation of those terms. Some people will say things like, I was in hypnosis, and equate that with being in trance. I see them as two very different things, but very correlated. So trance to me, and if you look, we're here with educational people and people paying money to learn. If you do some research and look at the most recent definition, according to Division 30 of the American Psychological Association, the definition that Division 30 put out a few years ago, and our most recent definition, I think, and I don't have it on my screen or anything, is a great definition for the word trance because it talks about state of mind. It talks about focused absorption. To me, that is not hypnosis. And if you take my intermediate class, one of the first things we're going to do is define hypnosis. And it is what we do as clinicians to assist and facilitate the experience that someone else is having that we would call trance. So let me just ask this question. For those of you that have done hypnosis and those of you that have not, trance, let's just define it very simply, is focused, absorbed attention that allows you to negate other things going on around you, where you're so focused and absorbed you don't pay attention to these things. And it may offer opportunities for experiences to be a little malleable, like your thoughts, your perceptions, feelings, belief systems, that kind of stuff. So if we think of trance like that, and ultimately hypnosis is about putting people in trance, and I will tell you, I do say to people, when would you like to go into trance? And what's it like for you to go into trance? I personally believe that's an absolute misnomer to state that, which I'll clarify in a moment because I want to ask you a question. At what point, when someone comes to you for any problem, whatever it is, when do they go into trance? When do you think that starts? So, what I would say to that is there's no question. I think most of us that do hypnosis on a regular basis would have to acknowledge that as we do that, we go into trance. We trance with them. But I would also suggest that you not guide people much because ultimately the work of hypnosis should be coming from the individual you're working with. Our job is to elicit experiences and utilize the resources that we help them find, that they have within themselves, that we utilize through these skills and these tools that we refer to collectively as hypnosis. So if in a hypnosis session, what I'm hearing from a student or somebody that I'm consulting with is they're doing all the work and you go here and you do this and you do that, then that to me is not really the hypnosis that I do. The hypnosis that I do is to facilitate an opportunity to help them change the trance that they come with. So the answer to the question, when do people go into trance, is really it depends. But I don't think they go into trance the beginning of it when they come to see you. So if we think about when trance starts, to me, it starts well before they walk into our offices or our clinics. The trance is their experience. So if someone came to me and they had lots of anxiety, to me, that is an anxiety trance. And people who come to me who are depressed, that is a depressed trance. People who come to me in pain, that is a pain trance. And we could go on and on with this. I had somebody who was in my office and they had a wart trance, believe it or not, because they had warts on their hands And they were very worried about these warts because they were unsightly and they didn't like going out and socializing. And this was their focused absorption. And the great thing about it to me is I don't have to put them in trance. That's a misnomer. I have to join the trance they're having and help them manipulate the trance they're experiencing and evoke from them an experience and opportunities so they understand they have the skills and abilities to help fix this concern that they present to me. As opposed to you come to me and I've got page 395 from Dr. So and so's book that I'm going to read to you. And after I do that, you will be magically fixed. So really part of hypnosis is one, getting to know the person you're working with. And by the way, do you know what two of the major issues that lead to most successful hypnotic experiences are? One is rapport. If you don't have good rapport, you already start off in the hole. And by in the hole, I mean you got to dig up to get even. The papers that I review, and Dr. Wilmarth is on our editorial board, and he reviews papers. We see and we read these things about people being in hypnosis, and they put people in trance. And to me, that's like, and you mentioned the old people being afraid, right? Like, why do we want to talk about, "Right, I'm going to put you in trance"? Like, no, I'm going to help facilitate an experience for you that in the end, by the way, if we were to talk about a re-alert, before we even begin to get there, I'm going to invite you to appreciate how you have taken care of yourself and how you have done this work as I have said words to you that may at times make sense and maybe they don't. But part of your unconscious mind knows what to take in and utilize for you because it knows how to do that. And we can thank Milton Erickson for that. And move beyond. No offense to Dr. Freud. I've read lots of Freud's work, and quite honestly, I tell people if Freud were alive today, he'd be really old. Uh, he would have even more revisions to his interpretation of dreams than he did when he died, because he would have continued. If you look at the interpretation of dreams, it has so many revisions, and I give credit to him for doing that. And I'm sure there would still be more today. And who knows? Maybe he'd have run into Milton Erickson and had a change of mind about hypnosis. I don't know. So trance to me is a state of consciousness. And I think it's an ever evolving, shifting, and changing state during our awake experiences. So it's not an altered state, in my opinion. This is going to be tricky, and I'm playing with words. It's an altering state. It's a shifting and changing and evolving state that at times is identifiable by somebody who is completely absorbed. The example I like to give, and you can call me a creep if you want, it's fine. I love to go when I traveled. Unfortunately, COVID put a little kibosh on that a bit. I really enjoyed teaching at hypnosis workshops and being in the airport and assessing people's trance states by watching them, right? So there's the ever checking my ticket trance state that looks like this.
Hmm.
Like, how many times do you have to look at the ticket to see when the plane's departing and what zone you're in? But they do. And then there's the I'm not really reading trance state. And then there's the oh my God, I can't believe I'm getting on this plane trance state. And then there's the I need to be on this plane trance state where the person is up and insisting they need to be because that's their focused, absorbed attention. And when that person gets on the plane, their trance state's going to change because their focus, their attention, their absorption will shift. And you could look at people on the plane and see their absorbed trance states. Some of them are very anxious. I myself like to look at the flight attendants because they're going to tell you almost everything you need to know at any time. If you see any of them open their eyes really wide, then you should tighten your seatbelt and be prepared for that thing to fall down and get into oxygen. So, trance is an experience. Hypnosis is what we do to facilitate the experience. The things that we say, the way we say them, the interventions that we utilize, like an induction, and we change the name of that, and a deepening, we change the name of that, and a real, we change the name of that. Uh, we change the name of everything. Next week we'll have new names. I don't know. Or somebody mentioned confusion technique. Do you guys know what that is? Anybody not know what a confusion technique is? Uh, Confusion is when you say things to somebody who may not really do trance well yet for whatever reason. And what you're trying to do is just break down their conscious, it's like the depotentiation of conscious sets. So you say things like, when you left your house today, did you go left or did you go right? Because either way you went, it was right when you left. And you might have taken a couple of lefts and that would have been right, as you left, you know? So you play, it's a word play kind of thing. You could do the yesterday, today, tomorrow, which is a lot of fun. Because today used to be tomorrow, but tomorrow it's going to be yesterday, right? So that's a confusion where the brain just goes, I'm done with you. I'm just going to go. And I'm ready to do whatever it is that we need to do. That's confusion. So that confusion technique is part of what we call hypnosis. One of the most powerful things and tools that I believe we have to do hypnosis work is our voice. It's not only how we say things, it's when we say them. So if someone's in my office and I'm doing more of a conversational intervention, I may say something like, that's really interesting. And I wonder if you wonder about what that really means to you right now. And this could start to become something that looks like formal hypnosis. It might evolve into formal hypnosis. Somebody may or may not close their eyes, doesn't matter to me. Because, by the way, when you're in trance, I hope through the day, your eyes are open most of the time. Because otherwise, especially if you're operating a heavy machinery like a car, you're in trance experiences, but your eyes are open, right? So you're alert, but not maybe fully alert, but alert enough to drive a car. So your voice is a great hypnotic tool. Though I do not suggest, you could do this during COVID, that you walk into a bank with a mask on and use that hypnotic voice. Hi, I'd like to make a withdrawal now. That's right. So, but your voice is very powerful and using it appropriately in trance, and none of us can speak like Dr. Wilmore, so don't even try. It is your major tool for hypnosis. That and the things that you do during the hypnosis session, that's hypnosis. People don't go into hypnosis. I I know I'm cutting, slicing little thin lines here when I say I don't even like to tell people that I hypnotized them. And the biggest reason I don't is because my ultimate goal is to give them the credit for what it was that occurred. Because, most people with mental health concerns that see me in my clinic do not take care of themselves. And the wonderful thing about hypnosis is in the midst of the session, as you notice the shifts and the changes and make suggestions for them, that you give them the credit for that and you empower them for having done that. So even if the objective of the session, the goal of the treatment intervention isn't necessarily met or changed or fixed, there's no doubt in my mind you've done something productive because you've enabled them to understand that they can care for themselves. And beyond that, in my brain, hypnosis is like one of the best anti-inflammatory interventions you can give someone. And as far as we know, Unlike Tylenol, it does not cause autism.
Hmm.